We're here to talk about the governor's letter he sent to Commissioner Ludeman telling him not to apply for the early medical assistance. We think this is a very poor decision. What the governor doesn't say in there is that we're already spending $1.2 billion on these two programs, and that we could get a federal match for that money so that our hospitals and doctors and nurses could get paid that extra. In this case, the total would be $1.4 billion of federal money that the governor is turning down. What does that mean to hospitals and doctors? It means that they will have losses because they're not getting paid an adequate amount for these, the GAMC group and the Minnesota Care group. And so what happens then is hospitals and doctors raise their rates to everybody else. These people are going to get covered in our hospitals. They will be treated, and the hospitals will lose money, and consequently those hospitals will have to raise the rates of the premiums for middle class people. So the governor is refusing to accept $1.4 billion of federal money and putting the burden on the middle class.
Well, that's about it. I would say that, Minnesotans have long supported providing care for those working class Minnesotans and lower income Minnesotans, and we have done for many years now that job with state-only dollars. And the federal government has said, thank you for doing that. Thank you for making sure that Minnesotans are getting that health care coverage, and for that we're going to reward you with a federal match. So the federal government is essentially recognizing the work that we've done, and they're offering us a 50% match for that work, and the governor is shutting the door on that.
I assume this comes as no surprise at all.
This is not a surprise, and nor is our response a surprise, but it remains a disappointment to me.
Still could be news.
Well, I assume that when we have a new governor, that that governor will immediately authorize this. It just seems to me foolish to turn down $1.4 billion of federal money that could be used to help our hospitals and doctors. The money does not go to poor people; it goes to doctors and hospitals and nurses.
The governor highlighted, I think his number was $433 million over 3 years. Does that number seem right according to your calculations, and B, clearly you think it's worth spending that state money to pull in this federal money?
We have done the math on this. The math is embedded in the law that he signed at the end of session, House File 1. We know that we're already spending $1.2 billion on healthcare. And we found a way to raise the $188 million to match, to draw down that 1.4. We stand by that math, and I'm not sure where the $430 million is coming from.
His was over 3 years.
The 188 is over 3 years.
The 188 is also over 3 years.
That's correct.
So is that increment? I understand that some of that delayed hospital rebasing and cuts to hospitals is already being set aside to pay for that. Is that true?
We made cuts to both providers and hospitals in order to raise that 188.
So that's being banked already?
I understand that it is.
Yes.
So are you saying he exaggerated the cost of this to the state by 2/3?
I'm saying I don't understand his math.
Yeah, we just looked at the numbers, and even in his letter to Commissioner Ludeman, he uses exactly the same numbers that the budget department gave us in the last week of session. So I don't know where he went from 188 to 400, but we just don't see his numbers. We looked at the sheets, and we would say it's 188. But let's assume that he is correct, which I don't think he is. You're talking about maybe $200 million, and he's turning down $1.4 billion of federal money.
Yeah, I think it's, first and foremost, we're going to be seeing a lot of, we're We're going to see a lot of fluctuation in the healthcare system over the next 3 years as we move through with the federal reforms. And we're already seeing, I think, a fair amount of upheaval. And I think the nurses' vote is evidence of that. I think the stories that we're hearing about the triage in GAMC are another example of that. We're spending $1.2 billion in Minnesota to provide care. And by not acknowledging that that is not adequate, we're essentially saying to middle-class Minnesotans, you pick up the costs for uncompensated care that we recognize. We know that there's uncompensated care. We're hearing stories daily about the implementation of GAMC, and the governor's choice is to pass those costs on to people who are paying property taxes and people who are paying health insurance premiums, rather than recognizing that the federal government is saying, here's 1.4 to match what you're already spending.
What are some of the things you're hearing about GAMC?
We're hearing about providers in rural Minnesota who aren't able to get reimbursement through the uncompensated care pool because they're not a hospital, and thus they're not able to get payment to prescribe medications for mentally ill patients. We're hearing about mentally ill patients in Hennepin County who are not getting their prescriptions filled because they're not yet signed up for a CCDS. We're hearing about cancer patients who can't get the right critical access dental care that they need before they can have their chemotherapy. So we are hearing real stories about Minnesotans who are struggling with the triaged GAMC program, and we're hearing, I think, real stories about providers frustrated with not understanding how the system works. I think the Department of Human Services is still issuing rules and instruction about how they're going to pay providers. So there's a fair amount of chaos in both greater Minnesota and in the metro area. And I think the impact is really on the providers and on those people getting care who we know are both sick and vulnerable.
This might have been asked already, but do you have a number or increment of what the state is sacrificing with by delaying early enrollment?
We would have to spend, our numbers are, we would have to spend over the 3-year period $188 million more than we are currently spending.
No.
But that would allow us to bring down $1.4 billion of federal money.
I think his question was by potentially delaying the early enrollment
Until
from
January.
now until January.
How much money are we
losing?
sacrificing? How much is this decision taking off the table?
We have that number?
Well,
Is
we
it
have
as
to
simple
do
as
math.
prorating it? I mean,
No, because it goes up towards the end.
We think that we think it's a loss of about $800,000 a day.
A day, starting July 1.
I think about 850,000.
Yeah.
and that's based on what's the source of that?
We did the
We
math
did
on
the
the
source of that.
yeah.
You take the 1.4 billion and divide by the number of days.
Although that's not, since it
Yeah.
ramps up, that's not an actual figure, right?
What do you mean?
Don't we get more money at different periods, so it's not actually day by day? So if we enroll on January 11th, we're not actually losing.
Well, we don't know what the enrollments are going to be. That's part of the problem. But if you take the 1.4 and divide it by the days, that's the number you get.
So maybe we should get you more math. How about that?
Well, I mean, if part of your argument here is that the delay is foolish, it'd be nice to know what the actual cost to the state is for that delay.
And then we think it's about $850,000 a day.
As you've both been back in your districts, other than talking to healthcare professionals and patients, do people grasp this? I mean, I would think people's eyes roll to the back of their heads when you say early enrollment MA.
They're starting to get the feeling that when I explain that these people aren't going to go away, they're still going to be in our communities, they're still going to get health care at the hospital, except the hospital won't get what it costs to treat them. So what are hospitals going to do? They're going to have to raise their rates to everybody else that has insurance.
And
that's starting to sink in.
Rachel, when I've talked with people in the district, the people I'm lucky enough to represent, and let them know that early MA is in law and it's paid for, and all we have to do is file a state plan amendment, their response is, huh? I mean, they are incredulous from my perspective. And this is just plain and simple. We're this close. They understand the cost shift that's occurring. They understand the price that they're paying for the governor's stubbornness on this point. So it's not a hard sell to the people in Minnesota at all.
And just to clarify once more, that you don't need to come up with that 188. You've already come up with it.
It's in the budget.
It's in the budget.
And part of the basis for the governor's letter was he doubted that the federal government would be able to meet its obligations due to the exploding deficit. Would you either of you care to address that?
Well, I suppose some people would have made the same arguments when we started Social Security and when we started medical assistance, when we started Medicare. All those things have been funded just the way the government said. What really kind of irritates me is this early enrollment option was the first time that Minnesota has ever been rewarded for being good. Every other time we get punished by the feds because we're good. And this was a reward to 11 states that had been doing the right things. And it was a way to help us get from now to 2014 when this entire group of people will be completely covered 100% by the federals.
I know Connecticut adopted this just yesterday with the announcement. Do you know if other states of the 11 are sort of down that track? Are we unique in that we're saying no at this point?
They're all in the process of doing it, and all this stuff takes time. But I know that I think it's Washington is moving ahead, and as you said, Connecticut. So there'll be I think all the 11 states will move ahead.
Connecticut's is at 50%, 57% of the poverty level. Did you guys ever talk about moving that number down from 75 or reducing the benefits to make it more of a matchup with?
That's
Yes.
what we're talking. Our bill and the numbers we've talked about is 75% of poverty.
Right.
We did, in our negotiations at the end of the session with the administration, we talked about going as low as 25% of the federal poverty guideline. But we know the majority of people served in general assistance medical care are at or below 25% of federal poverty. So they make at or below $2,000 a month. And so we didn't really save the state any money. It didn't have much of a fiscal impact.
$200 a month.
Thank you. $200 a month. $200 a month.
Because 75% is about $8,000 a year.
There's also a section in the letter where the governor is talking about Minnesota Care, and he says the savings from using this alternative instead of doing the MA expansion may give the next governor as much budget flexibility as possible to address the looming deficit. Do you read anything into that? Is he suggesting that that's on the table?
Well, he's suggesting what he always does, which is to not cover these people and use the money for something else and transfer the cost to the healthcare providers who then transfer it to the middle class.
We know that the best way to save money in healthcare, both Representative Huntley and I have been working now for 3 years together, trying to drive down costs in healthcare. And we know we can't do it by making blanket cuts. We have to change the way we deliver care, and we have to change the way we pay for care. And we have to do those difficult reforms. We have to work with the provider community to do that. They're being very clear with us, especially in Greater Minnesota, that the GAMC triage is not going to work. They're not going to opt in. It's not a statewide program. But there is an element of reform in there that we need to push forward. And if we want to save costs in healthcare, we have to do that hard work. And we can't stop here and say this is good enough, because it's not. Minnesotans are counting us to do our work.
Have you talked to anyone who's running for governor about this other than Calhoun?
I haven't today.
Yeah, I have not recently, but certainly I've talked to Intenza and Dayton, and they both support the early enrollment.
Okay. Thank you very much.
Thank you.
Thank you.
Nice to see you guys.